What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, September the 27th. We're going to talk about going to the dentist today. And for a lot of people, that's not what you put down on your calendar with a star right next to it that you're excited because you go to the dentist. But it's important to do those 6 months checkups. And I want to introduce you to Dr. Philip Batson and Dr. Elizabeth Abe from Columbia Healthy Smiles. Good to have both of you here.
Thanks for having us, Paul.
When we talk about going to the dentist, I was doing a little bit of research the other day, and those 6 month checkups that we're supposed to schedule to have our teeth cleaned really are a lot more than just teeth cleaning. Because many times the dentist is the first person that could alert you to a potential health problem down the road. How does that fit into it?
I would say oftentimes we can detect inflammation within the mouth or your gum tissues, and that can be correlated or have a strong correlation to other diseases.
To other diseases. I'm going to just go down the list here because when I was reading about it, it was saying that going to your 6 month checkup, your dentist could alert you to possible heart disease, possible kidney disease, diabetes, or Crohn's disease. Let's start, first of all, if you're examining someone's mouth, after you've done the cleaning, I know you're cleaning and the polishing, and then the dentist comes in and looks at your tongue, and pulls your tongue one way or the other and looks at your mouth. What, as far as heart disease, what are you looking for? What would be a sign that perhaps there's a problem there?
Well, constant inflammation of the gums is, the overriding factor. Constant inflammation in the mouth, that lingering inflammation is, what they have begun to look at for its connection to heart disease. And it's not that going to the dentist or good oral care is has never been proven to be a preventative measure for coronary, artery disease or heart disease, but there have been a lot of correlations that people who have poor oral health, poor periodontal condition, have a higher incidence of heart disease or a higher risk factor for heart disease and a higher chance for coronary artery disease. They are still trying to determine the linkage, if there is a linkage between that at all. Not correlation doesn't always mean causation.
Right.
But there can be an association with it, and they've shown that. And they also show people who have lost teeth, have had teeth removed, extracted, due to, decay and abscesses and infection. Also show a higher incidence of developing potential to develop heart disease. Again, whether those are connected or not is still in the research phase and in the studies, but it does give us an insight to people, maybe if their oral hygiene is not up to snuff or as good, they could be at a higher risk for heart disease.
Okay.
And it's something we can talk to patients about their overall health as well and what they're doing for their overall health.
And if you have an infection in your mouth and it's not taken care of, it can spread to the rest of your body.
It can. Bacteria can travel through the blood vessels. One thing they have looked at is how bacteria from the mouth can travel and potentially be damaging to your heart valves. It's something we have to take into consideration with patients who have artificial heart valves, actually, to be on the preventative side of that and take an antibiotic before they have appointments, dental appointments, if they've had artificial heart valves.
What is a sign that perhaps there's kidney disease there? Is that something that you would notice in the mouth?
Again, a lot of it goes back to the constant inflammation, and especially it really is really helpful with people who are on dialysis or maybe already established kidney disease, because their oral health could be just not as good. And so while it may not be a predictive indicator to tell someone they have kidney disease unless they're showing other symptoms, it's something if they're going through some of that kidney disease treatment of how do we help their overall health, and really if they're on dialysis to really be on the lookout, for what we can do to help them, because then they could develop maybe dry mouth or excessive bleeding, along with that inflammation, which is and that constant inflammation is what's really the most damaging to the cells and the teeth and gums.
Now, just because you have constant inflammation, that could be brought about by just poor oral hygiene, couldn't it?
It could, and there's also studies that show that a lot of people who have kidney disease also have periodontal disease. And again, it could be that the inflammation just overall is that underlying factor.
Are there any signs of diabetes that you can look for, that you see while you're examining a mouth? It says, maybe there's diabetes here.
Sometimes it's not what you see with diabetes. It could be what you smell with diabetes, actually.
Really?
Patients can have a sweet breath smell. And so if they're unaware, if they don't, maybe they haven't been diagnosed with diabetes, or they haven't, or maybe they're pre-diabetic, a sweet breath smell is a sign sometimes that somebody potentially could have diabetes in the way their body is processing things.
Okay, so what it all boils down to, those 6-month checkups, they're important. They're important for your mouth, and they're important for your general health. A lot of times, if somebody hasn't been to the dentist for a long time, tell them, what could they expect? It's not going to hurt.
No.
No, we're just examining and trying to get patients to, again, healthy oral health. And,
right.
And so whatever that may be.
Yeah. The dentist is going to be friendly. The dentist is not there to hurt you. I know when I was a kid, and I've told this story before, I was scared to death to go to the dentist because when I was growing up, they didn't deaden your mouth before they filled a cavity.
No.
And I will never, ever forget that first time that I had a cavity filled. I think I just about had to be strapped down to the chair. But there is no more pain. So if you haven't been to the dentist for a long time and you're concerned about it, go, and you'll find that they're friendly people. You get in that chair, you just lay back. It feels good on your back too. It feels real good on your back, and let them work on your mouth and take good care of you. Okay. If you have any questions or concerns, you can give them a call at Columbia Healthy Smiles. What's your number there?
573-875-7071.
Okay. All right. I want to thank you both so much for coming by, and thanks for being the first line of defense looking in our mouths there.
Thank you.
All
Appreciate
right.
it.
Good to have both of you here. Something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu. Bye-bye.